What is depression? It is characterized by persistent sadness and loss of interest in activities one normally enjoys, with an inability to carry out daily activities for at least 2 weeks. It is not a sign of personal weakness, nor a condition that can be willed away. It's a common mental disorder. Globally, over 300 million people suffer from it. It is the leading cause of disability worldwide and a major contributor to the overall global burden of disease. There are effective psychological and pharmacological treatments available. Depression in India. In India, the National Mental Health Survey of 2015 to 2016 reveals that nearly 15% of Indian adults need active intervention for one or more mental health issues, and 1 in 20 Indians suffer from depression. It is estimated India had over 258,000 suicides in 2012, mostly from those 15 to 49 of age. A study conducted by the World Health Organization in 2015 shows that 1 in 5 Indians may suffer from depression in their lifetime, equivalent to 200 million people. Due to the stigma associated with mental illness, a lack of awareness, and limited access to professional help, only 10 to 12% of these sufferers will seek help. Depression in the USA. 16.2 million adults, 6.7% of all adults in the country, have experienced a major depressive episode in the past year. It's estimated 15% of adults will experience depression at some point in their lifetime. The prevalence of adults with a major depressive episode is highest among individuals between 18 and 25. 44,000 Americans die by suicide each year. 37% of adults with depression receive no treatment at all. Major forms of depression. Melancholic depression. Loss of pleasure in most or all activities. Worst symptoms in the morning. Excessive weight loss. Atypical depression. Excessive sleep or sleepiness. Increased appetite and body weight. Hypersensitivity to interpersonal rejection. Catatonic depression. A rare and severe type where the person is mute and remains immobile or experiences purposeless or even bizarre movements. Postpartum depression, suffered by women after giving birth. Onset usually occurs 1 month after delivery. It can last up to 3 months. Medication for depression. Antidepressants are an option, most often for more severe cases, that can help ease the symptoms and return a person to a better level of functioning. Medication is often crucial for cases of bipolar, typically a mood stabilizer. Antidepressants are not habit-forming and generally have minimal side effects. Medication for depression, Part 2. Doctors may need to try a variety of medicine before finding one that works for the individual. Some improvements may be seen in the first few weeks, but they must be taken regularly, and it can take up to 8 weeks for the full effect to occur. Don't be tempted to stop taking them early just because you think they aren't helping. You may also need to keep taking it 4 to 9 months after you feel better to prevent a reoccurrence of depression. Helping a loved one with depression. Don't try to cheer up a depressed person. It can feel minimizing. Simply ask if there's anything you can do to help. The answer will often be no, but the support will be felt. Avoid critical or shaming statements. Be empathic and understanding. Empathize with feelings of sadness, grief, anger, and frustration. Other feelings will come in time. Helping a loved one with depression, Part 2. Don't argue about how bad things are or are not. Don't insist that depression or sadness is not warranted for their situation. Don't react with anger, even though your efforts to help may be resisted or rejected. Helping a loved one with depression, Part 3. Advocate for their recovery. Convey hope. Emphasize that depression is very treatable. Encourage them to seek help. Offer to go with them to the counseling center. Suggest they try attending a support group. Whether online or in person, support groups are another good way of reminding someone they are not alone in their struggle. Remind them that depression is a medical illness, not something to be ashamed of.